Our mouths are full of bacteria that combine with saliva to form a sticky film known as plaque, which builds up on our teeth. This plaque is an important factor in the development of both tooth decay and gum disease. Some types of bacteria react with the sugar in our diet, producing acid, which breaks down the tooth surface and causes tooth decay. Other bacteria in plaque irritate our gums, making them inflamed and causing them to bleed and potentially become sore. We will now discuss both tooth decay and gum disease in a bit more detail. As we've said in the introduction, tooth decay is caused by the interaction between plaque and sugar. The bacteria in plaque convert the sugar in sugary drinks and foods we eat into acid, and this acid reacts with the tooth, weakening the hard enamel surface. We describe these events as acid attacks. Each acid attack lasts approximately 30 to 60 minutes until the saliva neutralizes the acid and eventually starts to repair the damage. We call this remineralization. The whole process of remineralization and repair takes time, and repeated and prolonged acid attacks will eventually cause a hole or cavity to form, which may lead to pain and infection. So it follows that consuming sugary foods and drinks frequently throughout the day increases the risk of tooth decay, whereas keeping foods and drinks containing sugar to meal times allows time for our teeth to remineralize, or in simple terms, to repair. For older people, there are a couple of things which we need to think about. Many older people produce less saliva and have a dry mouth. This increases their risk of tooth decay because the minerals in saliva are an important part of the remineralization and repair process. Older people may also have a high sugar intake due to liquid medications containing sugar or food supplements such as Fortisip or Ensure. More detail on how to deal with these risks will be covered in section 3, which focuses on prevention. As well as knowing how to prevent tooth decay, it's also important to be able to spot the signs or symptoms. Tooth decay can cause continuous or occasional pain, sensitivity to hot or cold food and drinks, tenderness when biting or chewing. You may see obvious holes or changes in the color or texture of the tooth surface, and sometimes bad breath or unpleasant tastes. So in summary, what causes tooth decay? Tooth decay is caused by the frequent consumption of sugary foods and drinks, which means that our teeth don't get a chance to repair. Moving on to gum disease. As we have already said, some types of bacteria in plaque irritate our gums, making them inflamed and causing them to bleed and potentially become sore. Removing as much plaque as possible through toothbrushing and other methods reduces the amount of plaque, and this in turn reduces the inflammation. So poor oral hygiene is the most common cause of gum disease. Not brushing our teeth properly or regularly can cause plaque to build up on our teeth, which leads to gingivitis, reddened gums, or periodontitis, which is when teeth become loose. Plaque is usually easy to remove by brushing and cleaning in between our teeth, but it can harden and form a substance called tartar if it's not removed. This sticks more firmly to our teeth than plaque and can usually only be removed by an oral health professional. Several things can increase the risk of developing gum disease, and these include smoking, our age. Gum disease becomes more common as we get older. Some medical conditions, for example, diabetes or a weakened immune system because of conditions like HIV or certain treatments such as chemotherapy. Malnutrition, stress, and some medicines, for example, such as antidepressants and antihistamine that cause a dry mouth, also increase our risk. As well as dealing with these risks if we can, the key to preventing gum disease is removing the plaque that we have talked about through tooth cleaning and other methods discussed in section 3. As well as being able to prevent gum disease, it's also important to be able to spot the signs and symptoms. Gum disease can cause red and swollen gums, which bleed when brushing or flossing, bad breath or an unpleasant taste in the mouth, collections of pus that develop under our gums and around our teeth can also cause pain. And finally, some teeth may become loose, and that can make eating difficult. Mouthwashes and other products containing chlorhexidine gluconate may help, but remember to follow the manufacturer's instructions. If a resident brings in these products to the care home, it's important that these are not used directly after brushing teeth with normal toothpaste. And with prolonged use, or if used close to drinking tea or coffee, chlorhexidine can stain natural teeth. This discoloration can be removed by a dentist, a hygienist or therapist at the next dental cleaning, and does not usually occur unless use exceeds several weeks. So in summary, tooth decay and gum disease are preventable, and the methods for prevention are covered in the next section. In this section, we have covered gum disease is caused by plaque, tooth decay is caused by sugary foods and drinks interacting with that plaque, and both tooth decay and gum disease are preventable through regular daily mouth care and dietary measures. A dentist can diagnose problems and provide advice, so it's important to have regular checkups. But what's even more important is the dental care and prevention that takes place every day. Oral hygiene is important for good oral health, but so is being aware of the number of times we and those we look after have drinks and foods containing sugar. As we've discussed, remember that older people may have frequent and high sugar intakes due to their medications or the diet that they need. In these cases, good oral hygiene is even more important.